Pertussis is a bacterial infection that can cause upper respiratory symptoms that can be dangerous to our younger patients, but also cause a cough that can last several weeks to even months for some of our patients as well. Whooping cough is becoming more common, unfortunately, probably for a variety of reasons, maybe declining vaccination rates or waning immunity from our previous vaccines. So that's why we're encouraging our adults to get vaccinated at least once in their adult life. And actually, pregnant women are encouraged to get a tetanus and whooping cough vaccine in their third trimester of pregnancy to help protect their baby as well.